Basic pharmacology. Pharma means medication. Logy is study. So, study of medications will be the things to discuss today. First few slides, we need to know what are those commonly approved abbreviations in pharmacology. As you can see in this slide from left, AMP, AMP for ampule, CAP, cap, capsule, cream, elixir, liquid, lotion, suppository, syrup, tablets. These are pretty simple. That's straightforward. You can understand the meaning. But the last word here is ung. That's an exceptional word. Ung means unguium or ointment. Regarding strength and system of measurement, we have C for cup or Celsius, DS for double strength. G for GM is gram. So regarding gram, 1,000 less time, the part will be milligram. If we go 1,000 times less than that, that will be microgram. So gram, milligram, microgram, and kilogram, those are related. Later on, I will show you the relationship once again. GTT, got it, means drops, like eye drops, GTT. L, liter, LB is pound. We have OZ for ounce, QT, quart. Look at those last two words here, TBSP and TSP. Tablespoon and teaspoon. And we know the relationship is 3 times. 1 tablespoon is equal to 3 teaspoons. Now the route of administration. Intradermal, which is within skin, is abbreviated as ID. Intramuscular, IM. Intravenous, IV. Injection is INJ. Per oral or by mouth is PO. Per rectal, PR. Subcut is the word for subcutaneously, which is under the skin. So the difference between these two, ID and subcut, is this. ID, the injection is given within skin. Example, PPD or Mantoux test. Whereas subcut injection given below skin, and the example is insulin. Top means topical. Regarding time or frequency of administration, we have AC, PC. AC means anti-sebum, before meal. PC stands for post-sebum, after meal. Like AM, PM, before noon and afternoon. With Q, I have some highlighted words here. You see, QH stands for every hour. Q means every. So every hourly, QH. Every day, QD. Every 4 hourly, Q4H. And every 6 hourly, 4 times a day is QID. BID means twice a day, 12 hours. NOCT, not, like notches, means night. PRN is for whenever necessary. QAM, that's the every morning. Stat is an important word. Stat means right away, immediately. Addict is the word for as directed. If a solution has to be stirred or shaken, we use this word agit, agitation. AGIT, agit means to shake or to stir. AQ stands for aqua or water. ASA, aspirin, acetyl salicylic acid. Compound is CMPD. Draw as this written is DAW. Then dilute, equivalent, extract, dispense. Some chemistry words we need to know here. We know from periodic table that iron is an element and it's expressed as Fe. Ferrous or ferro, it means iron. Similarly, potassium is expressed as K, calcium, sodium, Na or natrium. Water has the abbreviation H2O because there are two hydrogen and one oxygen atoms in water. MDI stands for metered dose inhaler. Mineral oil, then we have nebulizer NEP, and NKA stands for no known allergens. NPO is for nil par os, that means nothing by mouth. Patient is advised to have nothing by mouth, and the order should say NPO. NV for nausea, vomiting. Over the counter is OTC. When we purchase any medication as OTC, we don't need any prescription for that. Oxygen, O2. New refill, no refill is NR. QS is quantity sufficient. QNS is quantity not sufficient. Per means through or by means of. Last slide regarding abbreviation is this one. RX for prescription treatment. You'll see that every prescription your provider starts with this symbol RX, which means take the, requesting the pharmacist to take this medication, give this medication to the patient. Suspension, symptoms, tincture, telephone order, verbal order, treatment. Those are some other important abbreviation in this last slide. You'll get acquainted when you study these things within few practice or few minutes, or you will get acquainted with these important abbreviations. Now here comes most important part of this basic pharmacology lecture is to know medication classification and their uses. Analgesics that relieves pain. So think about the word analgesics. An means absence. Algo or aljo means pain. So any medication that removes pain, pain reliever. Some of them are mild analgesics, belongs to the group NSAIDs, non-steroidal anti-inflammatory drugs. That includes aspirin, acetaminophen. Acetaminophen is a very common medications. It's a generic name, but in trade name, you all have heard about those names: Tylenol, Tylenol. That's the trade name for acetaminophen. So this belongs to painkiller medication in this group. On the right-hand side, these are stronger medications, stronger analgesics like morphine, pethidine, codeine. So these are only given when patients have too much pain, intolerable pain, because if it is given regularly, it can cause addiction, drug dependency. So they belong to the narcotics. We'll talk about this later on when we discuss scheduled drugs. Our second group of medication is antacids, antacids. In our stomach, we have hydrochloric acid, very strong acid there that helps our digestion process. Sometimes this stomach acid is responsible for stomach ulcer, GERD, peptic ulcer, duodenal ulcer. So we need to neutralize this thing. And to do that, we can use simple antacids like calcium carbonate or some proton pump inhibitors. Many of those medications you'll find to end up with prazole at the end. Prazole, ZOLE. For example, omeprazole, esomeprazole, rabeprazole, pantoprazole. So you see that they all have a rhyming words with prazole. So this is how you can remember a lot of those names. If you know the prazole means they belong to antacid medications working against stomach acid. Bacteria is responsible for many of our infections, and we need antibiotics to kill them. And there are many of those antibiotics. Some examples are cephalosporins, dicloxacillin, ciprofloxacin, amoxicillin, azithromycin, ceftriaxone, and many, many more of those antibiotics. Point to note that they kill bacteria. This patient, you see, he's having some problem with breathing. Normally, if you take a look at the lower bronchioles, you see it is open. The airway is open. But for this patient, it's narrow and he's having some breathing problems. So to open this up, we use anticholinergic drugs. For bronchospasm, we use anticholinergics. Example, ipratropium and dicyclomine. A patient who is at risk of heart attack or stroke or some other sort of clotting disorder, physicians prescribe blood thinner, also known as anticoagulant. Coagulant means something that clots. We want to stop that. So we call it ANTI, anti. Anti means against, opposite. So warfarin, enoxaparin, heparin belongs to that group, anticoagulant, that does not allow blood to clot. Because clotting inside the body is very much fatal. And to remember those names, you see they all have arine at the end. Warfarin, enoxaparin, heparin. This is anticoagulant. Next group is anticonvulsant or anti-seizure. Whenever we have some unusual activity or uh, multiple focal point in our brain, we know that brain controls muscles. And if it is not normal, that can create convulsion, uncontrolled, unwanted muscle contraction. We have to stop that with anticonvulsants like clonazepam, phenytoin, gabapentin. This patient you see is uh, suffering from depression. Okay. And to stop the depression, antidepressants like doxepin, fluoxetine, duloxetine, selaginine can be used. At least you can try to remember the second and third one because these are rhyming, fluoxetine, duloxetine. If a patient is passing loose watery stool more than 3 times a day, this is called diarrhea. Diarrhea for a long time can cause problems like losing too much water or salt, electrolytes can create a life-threatening condition. So how to stop that? Anti-diarrheal medications, for example, loperamide and bismuth subsalicylate. Our next patient is receiving chemotherapy. While receiving that strong medication, anti-cancer drug, he is having nausea, vomiting. It's a very bad experience when we have this nausea, vomiting. Even during pregnancy, it can be one of the very much difficult situations. So medications like ondansetron, metoclopramide, they belong to a group called anti-emetics. Emetics means something that causes um, nausea, vomiting. And if we want to stop that, we need anti emetics. This is fungal infection. You see that on toes, this patient is having fungal infection on his skin. And to treat this patient, we need antifungals. With the exception of nystatin, most antifungals will end up in azole. Earlier, I gave you prazole for antacid medication, but azole belongs to antifungals. Fluconazole, iconazole, miconazole, ketoconazole, they all belong to antifungal medications. Our next patient is having allergies. It can be due to pollen, dust, mite, or seasonal. And most of the allergies are due to our body's over activities or overreaction, and the histamine is released from mast cell. To stop that, we need antihistamines that include diphenhydramine, cetirizine, and loratadine. Antihistamines. This patient, you see her, she's taking antihypertensives every morning. Hypertension means high blood pressure. And to treat that condition, we need antihypertensives. There are many of them: losartan, valsartan, metoprolol, lisinopril, clonidine, and a lot. But unfortunately for this patient, while she was taking lisinopril, she developed facial swelling. So this can happen. Some medications may have some side effects. All we have to be aware of those things. So in that case, we'll have to contact the provider and discuss with the other options. So facial swelling, one of the common problem with lisinopril. For the valsartan or losartan, people may have orthostatic hypotension. That means they experience lightheadedness, dizziness when they stand upright from sitting or lying position. Now, the next patient we see is in severe pain, and it shows that he's having pain in his joints, which is likely to be arthritis, joint inflammation. Inflammation is like a battlefield when our body's immune cells, they are fighting with uh, the unwanted chemicals or immune modulators from outside the body or inside. Sometimes they are known as antigens. So these things can create so much pain. We need anti-inflammatory drugs. Some of them, you know, by some trade name like Advil. Advil is the trade name, generic is ibuprofen. Aleve is another trade name. You know this by naproxen. Naproxen is the generic, trade name is Aleve. Though it's a cartoon, but it is true that if we take a lot of those animal meat, animal fat in our diet, it can create high cholesterol in our body. Hypercholesterolemia, that's the name. In our blood, high cholesterol. And to treat that, we need something that reduces cholesterol, or we call it anti-lipemics. Lip means lipid, fat. Emia means blood. So anti-lipemics are going to reduce blood fat. Torvastin, simvastatin, rosuvastatin. So those are statin drugs commonly used along with fenofibrate. If we compare these two person with their bone density, you can clearly see that left side, this woman is having strong, healthy bones. in comparison to the right one. That woman is suffering from osteoporosis, and because her bones are very much brittle, decalcified. Most of the calcium and other minerals are lost from her bone. This usually happens after menopause. So to stop osteoporosis, we need anti-osteoporotics like alendronate, epandronate, and calcium. She looks like um, out of the world. Like if we see this type of patients in psychiatry ward, we know that it's some special case. Many of the times, we diagnose these kind of things as psychosis. Psych means mind. Osis is a disease or condition. So disease of mind, we express as psychosis. And ketapine, haloperidol, risperidone are antipsychotic drugs. This one is easy for you to remember because you all know this name, acetaminophen, as Tylenol, which is given as antipyretics. Pyrexia is the medical word for fever. Fire is fire. So anyone in fever will be showing that he is having fire in his body or her body. That is why the name is pyrexia. And antipyretics are those which can reduce fever, like acetaminophen or Tylenol, ibuprofen, Advil, and aspirin. Low back muscle spasm. Antispasmodic will help these patients with muscle spasm, and that includes cyclobenzaprine and methocarbamol. This patient is having pneumonia, and one of the symptoms of pneumonia is cough. Relentless cough is productive. As you can see, inside the lungs, those alveoli are full of inflammatory fluid. To help these patients, we need cough suppressant medication. Okay. Antitussive or cough suppressant uh, like dextromethorphan, codeine, guaifenesin are needed for relieving cough. Antitussive is that word. These nice looking red balls started with yellow crowned things. This is coronavirus. And there are many viral infections we have to face. Fortunately, most of the infections are dealt by our immune system. That's the good news. Bad news is, unlike antibiotics for bacteria, we have very limited options for antivirals. And but easy thing is for us to remember that most of these antivirals, they will end up with VIR at the end. Acyclovir, oseltamivir, valaciclovir, remdesivir, molnupiravir. You see, all of them are having VIR at the end. You can easily know this is antiviral, with one exception, interferon. Anxiety needs to be dealt properly because if it is too much, that can cause many of those daily life problems. So we need anxiolytics, right? So usually anxiolytics are safe. It may cause a bit sedation, relaxation. We have to check vital signs. Um, Other CNS depressants, when we are using with that, we can be dangerous, especially person who is alcoholic. So medications like clonazepam, diazepam, lorazepam to be given, and patients should be properly educated about alcohol and other CNS depressant causes respiratory arrest. This is an asthma patient. Normally, our bronchioles should be open like this. Air will go in and out. But in this case, her bronchioles are constricted, so she can't breathe properly. While using this bronchodilator, bronchodilators will make the bronchioles to dilate. Albuterol, isoproterenol, theophylline are some examples of bronchodilators. All of these kids are paying attention except the boy in red shirt. It's a symbolic picture of ADHD, attention deficit hyperactivity disorder. Methylphenidate, modafinil can be used to help these patients. Oral contraceptive pills or hormonal pills, they work by stopping ovulation, thinning the uterine lining, and thickening cervical mucus. And their names, at first glance, it may look very difficult, like this: medroxyprogesterone acetate, ethinyl estradiol. But I have a tip for you. You know that women have natural hormones, estrogen, progesterone, and you can find those names hidden inside. Look at that. Medroxyprogesterone acetate. So progesterone is here. Ethinyl estradiol. So that sounds like estrogen. So easy for you to remember those uh, contraceptives with hormonal preparation. Our next patient is suffering from nasal congestion. All right, that can cause pain, sinusitis, blockage of nose. And to help her, we can prescribe decongestant like pseudoephedrine mometasone. You'll find it as OTC drug. These are kidneys, but it looks very weird because it looks like a tap, water coming from the kidneys, just to show that the kidneys produce urine 24/7 to remove unwanted waste materials from our body, but we can control it like a tap with the medications called diuretics. Diuretics like furosemide, hydrochlorothiazide can increase the amount of urine if needed. In some situations, diuretics are prescribed. Last four slides about these four different classes of medications are coming up. These are hormone replacement therapies. There are many hormonal glands in our body, and sometimes if we are lacking those hormones, our body cannot work properly. Say thyroid hormone. We have to replace it with levothyroxine. Or diabetic patients, we have to provide them with insulin. Desmopressin when the ADH is lacking, or estrogen in women. These are hormone replacement therapies. This patient is suffering from constipation. And according to the definition, when a patient is having hard stool less than 3 times per week, that is considered as constipation. Magnesium hydroxide and bisacodyl will help these patients. For diabetic patients, there are some oral medications other than insulin subcutaneously. These are the oral like metformin, acarbose, and glyburide. Our last patient here is having some sleep problem. Zolpidem, temazepam, azopiclone are provided as sedative hypnotics, which is the sleep inducer sleep medications. So these are, in short, different types of medications. We need to know their name, what group they belong. I mean, what is the mechanism of action? How do they work? And in few cases, some side effects. We'll have to get acquainted with those things. Now, for the last part of this lecture, I'll take another 10 to 15 minutes to finish this. And this time, we are going to discuss some important issues, starting with scheduled medication. Think about medications like marijuana or heroin, morphine, fentanyl. These are medications, but these drugs, uh, they have a high potential for abuse. And that's why we have to be extra careful. Usually, there is no refill unless it is actually given by the provider, and only licensed practitioners with the narcotics, they can allow this prescription. So remember that these are some medications that can cause addiction. People may abuse it. We need to know what schedule they belong. There are 5 schedules, 1 through 5. 1 is the highest one, then 2, less, 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 like this. Regarding measurement, mathematical conversions, and doses calculations, you see milli means 1000 times less, micro means 1 millionth time less, kilo is 1000 times more. In the USA, we are acquainted with the conventional system with pound, ounce, quart, gallon, but medical practice, they follow this metric system because that is much more easy to follow, and um, it's good for everyone to do that. And they have this relationship like this. If you start from the base at the middle, you see that number 1. If I say it's 1 gram here, and going to the left, 10 times more will be 1 decagram, 100 times more hectogram, 1000 times more will be kilogram. Again, from base, if I go to my right side, 10 times less will be decigram, 100 times less will be centigram, 1,000 times less will be milligram. There's a mnemonic called King Henry died by drinking chocolate milk. King for kilo, Henry for hecta, died for deca, by is base, drinking deci, centis chocolate, and milli for milk. You can try to remember that, uh, but at least for the pharmacology things, a few things you must know is this. One is to know that 1 gram equals 1000 milligram, and 1 milligram is 1000 microgram. Same thing goes with liter, that 1 liter equals 1000 milliliter, and 1 milliliter is 1000 microliters. This is an important slide for everyone to follow. That shows the conversion from household value to the metric equivalent. You can skip the apothecary value. Say, for example, 15 drops or GTT equals 1 milliliter. 1 teaspoon is 5 milliliter. 1 tablespoon is 15 milliliter. This is why 3 teaspoons will make 1 tablespoon. 1 fluid ounce, which is 2 tablespoons, is 30 milliliter. 1 gallon is 3,830 milliliter, almost close to 4 liters. 2.2 pounds will make 1 kilogram, and 1 inch equals 2.54 centimeters. Forms of medications and their routes are here, like aerosol, tablets, capsules, creams. Many of these things you already know. You want to focus on some important parts here, like these drops. You know, there are 3 types of drops that are used in medical practice. If it is otic drop, that is given by ear. Ophthalmic drops are by eyes, and nasal given by nose. So otic, ear, ophthalmic, eye, nasal, nose. In this picture, you see 3 different other formulations. The young girl on the left upper corner is using an inhaler, and it has the aerosol inhaler, and using that device helps her to, uh, this is a spacer, this is called a spacer, helps to breathe properly very young kids or elderly people may use this thing. The second one on the left side is the sore throat lozenges that contains menthol, and it's like a candy. And liniment sounds like ointment. They are used as topical medications. We all know about tablets. We know about capsule. But if we combine these two, it shows that its shape is like a capsule, and but its ingredients are formulated as tablet. So this is known as caplet. Capsule plus tablet equals caplet. Patches are used topically, that means over the skin, like transdermal patch for nicotine. These patches are used over skin. Powders are given topically. Solutions can be oral, topical, vaginal, urethral, and rectal. Rectal enemas, self-administering, can be in solution formulation. Suppositories can be vaginal or rectal suppositories. Tablets, we'll talk about that with different options of tablets. But before that, I have an interesting topic for you. Look at these two names. Chlorpromazine on your left side, that is an antipsychotic. Chlorpropamide to your right, that is anti-diabetic. So both are very close. Listen to these words: chlorpromazine, chlorpropamide. They sound alike medications. So but their uses are very much different. First one is used for psychotic patients. Second one is for diabetic patients. So these are known as look alike, sound alike medications. Right? So they may create some problems. Another example is like Celebrex or Cerebix. The first one is arthritis medication. Second one is for seizure. So we have to be extra careful, extra cautious when we encounter this type of look-alike, sound-alike medications, so that we can avoid any unwanted mistakes or errors. Parenteral routes. Okay, let's start with enteral. Enteral medications are given by mouth. It is going through intestine. So the word is enteral. Parenteral means beyond this digestive system, like epidural given in the spine, intraarterial within artery, intraarticular within joint. We are allowed to do the intradermal injection as a CCMA or intramuscular within muscle. This picture shows those in epidural and intraosseous injections. We are not permitted. Only the physicians and the trained nurses can do that. Intraperitoneal is given into the peritoneal cavity, intrapleural, intrathecal,
Morning,
IV,
Professor.
venous.
I don't see nothing on the screen. Just blank.
So intravenous injections, we use the major veins for subcutaneous under the skin. Regarding the enteral, that is going through mouth and intestine, three words we need to know. If it is oral, that's simple. Patient take medication by mouth, swallow it, that's it. But if it is given against the cheek, this is buccal, and under the tongue, that will be sublingual. So look at this picture. It shows the difference between those two. The left picture shows under the tongue that medication is given. So this is sublingual. The picture to your right, that is buccal inside the mouth. Right. Now, we are discussing those different routes of administration. Last few slides are coming up. And three important topics I want to discuss before we finish this pharmacology discussion today. The word pharmacokinetics, what does that mean? It means that once we take medications inside, it will go through our system, and four things will happen: absorption, distribution, metabolism, and excretion. ADME, you can easily remember ADME. Absorption in the intestine, distribution through bloodstream, metabolism in liver, and excretion through kidneys and uh, digestive system. In elderly people, they have their metabolism rate very low. So this is the reason why they have to take less medications, or we have to provide them less medications mm, for these patients because their metabolism is less. Another thing is the half-life, T half. That means the time it takes for half of the medication, 50% of the medication to be processed and eliminated from the body. Say, for example, I have taken my medication at 7 a.m. in the morning, and its half-life is 2 hours. So every 2 hours, 50% of that medication is excreted, going out of my body. That is called half-life. Medication administration, you are the person who is in charge, but there are some rights to follow. Among so many of those rights, if you know at least first six, that will be enough for now. Like this one, right person. We have to know if whether this is the right patient. We have to check their ID, at least their first name, last name, date of birth, ID number. Two of those identifiers are needed to know this is the right patient. For medication, check expiration date, check if it is the right medication. As we mentioned earlier, sometimes it is look-alike or right sound-alike medications can be. If you have any question, any doubt in mind, just check with your supervisor. For the doses, yes, there should be it should be within the normal range. If anything unusual, always ask questions. Right time can be in the morning, afternoon, and evening, but usually, say for example, diuretics are given in the morning or afternoon, never in the evening. If you find something like that, just uh, check on with your supervisor. Regarding right route of medications per oral, subcutaneous, intravenous, say insulin has to be given subcutaneously, but the order says give it intramuscular or IV. That's very unusual, probably wrong. So this is what we have to mention. We have to find out exactly what is the order. You have to double check, triple check um, what those medications. So right person, right medication, right dose, right time, right route, and right documentation. Uh, Everything should be documented. So that brings us to end of this important lecture on pharmacology.